Hare Krishna, dear devotees. Pancharatna Das here from Mayapur, broadcasting on behalf of the GBC Strategic Planning Team. And tonight, we're going to be going further into the second wave of COVID-19 pandemic in India. And as you know from our title, it's not just a wave. It's like a tsunami. I mean, we're going to be seeing something about really what's going on. And it's our really great pleasure to have again with us Dr. Madhavananda Prabhu, who is the director of the Bhaktivedanta Hospital, one of the founding members, an old friend of mine also, known for quite some time, and a person on the front lines of this pandemic. You'll be telling us more about what the Bhaktivedanta Hospital has been doing in regards to this. And so really qualified to help us understand what's going on now in India. Our audience is all over the world. We have people from all different countries. We especially are hopeful that devotees from India can be online for this, because we're going to be taking questions. We're going to be answering questions. We'll be having some presentation by Madhavananda Prabhu, and then we're going to take questions. So, Madhavananda, would you like to give any further introduction to how we're going to be spending our time today?
Thank you, Pancharatna Prabhu, and to all the viewers, Vancha Kalpataru Vaishya Kripa Sindhu Bevacha Paditanam Pavanebhyo Vaishnavabhyo Namo Namaha. Pancharatna Prabhu, thank you. I'm being introduced by you as your old friend, and that's a great qualification for me. So,
thank you. It's a great benefit for me. By the way, Madhavananda, before we continue, I should, because our viewers are seeing this scrolling little message down at the bottom, and let me explain that to our viewers.
Yes.
It's a disclaimer because, we are a servant of the GBC body. However, our content, what we're going to present today or whatever we're presenting, it's not official position of the GBC body. It's what we have gathered from different devotees that we feel are valuable for the devotees to hear and listen to. And we want to make it clear that the GBC body itself and the GBC SPT is not a medical organization. We don't give medical advice. We are not encouraging or discouraging vaccinations or this or that or whatever. So, but we want to offer what devotees in our community are doing and let our viewers take from it what is valuable. So that's just a little disclaimer that for our audience. So pardon me for that, but I thought we needed to cover that before we go further. So again, Madhavananda Prabhu, tell us about what we're going to be covering this evening.
Yeah, so thank you, Pancharatna Prabhu, and it's very great honor for me to be with all of you, the devotees of ISKCON. And I was wondering, what is this topic we are discussing on the Vaishnava Forum, that we have to discuss about some virus. And then, of course, historically, we can see that even the Brajvasis, headed by Upananda, they were discussing the calamities coming in Gokul and the strategies to be followed. And then with those strategies, then it moved on from Gokul and went to Vrindavan. So this is also a part of discussion from the current times, that we are definitely all over the world, devotees are facing some calamity. And I think it is not inappropriate to spend time on such topics because they do affect our dear Vaishnavas, ourselves, and the movement as a whole. So thank you for choosing this topic, which this is the probably only topic which I can speak here. I am not so adept with the scriptures, but medically, yes, we can.
You have already connected us scripturally, so thank you very much.
Thank you. So, Pancharatna Prabhu, what we will do is, I have prepared some PowerPoint presentation. You can share one by one slide, and then we can move on to discussion with that. So, please go to the next slide.
All right, let me just get myself positioned here. All right, yes, here we go.
Yeah, here. So we are today's topic is basically dealing with the second wave of coronavirus, and we can see that this is the WHO's report as of yesterday. So globally, about 14 crore 75 lakhs patients are affected. And in India, 1 crore 78 lakh patients are affected. And
Yeah,
deaths globally, 31 lakh deaths have occurred. In India, 2 lakh deaths. Vaccination,
yeah,
similar data. So this is the magnitude of the problem which we are facing. And first time in this century, we are coming up something like this magnitude. The last pandemic, which happened in 1918, which was of Spanish flu, and from that, what we learned is that at that time also, roughly about 500 million people were affected. Huge
right.
number of people all over the world. And anything between 20 to 50 million, exact data is not there, people died.
I see.
Similarly, here, no matter how much we mock at this virus or we suspect that this is some kind of man-made thing, whatever we may say, the reality is that it is affecting everyone, every country. Practically everyone is confused on how to respond to it. But from the previous experiences, the epidemiologists, the WHO, and various infectious disease specialists, they know that this kind of infection, they come in waves.
Right.
So when the first wave goes, generally the second wave is a higher kind of a version. It is, and third wave can be much higher. So no matter how you feel at the when the first wave goes, like even in India, you can see that people were completely comfortable. They felt, even Indian people declared that we have won the war. In fact,
Yeah,
the Union Health Minister himself, he said, ki, uh, we will be exporting a lot of medical equipment and everything for the other countries because we don't need it anymore. Little did he know that very soon he will be himself struggling for the supplies. Of course, the supplies are quite well managed right now, but
yeah,
it could have been better also. But
yes.
the fact remains that whatever the second wave comes, it comes suddenly, and in India it hit the nation by end of February, and now we are peaking. The April peak of this year is double than the last year's. In
Yes,
US,
yeah,
in
double.
US,
I mean,
yeah,
it really is. I've seen that
yeah,
wave
exactly
now.
double.
It goes
Yes,
like this, and it goes like this, and it goes boom.
yes, yes. So in US also the same thing happened. We can learn from US also
Yep,
that
yep,
the first peak happened in April 20. So that was say 1x.
yeah.
The second peak happened, the second wave came in July and it was 3x
Three.
practically. 3x. And by Jan it is almost 3x and plus something. So it
Yeah,
goes on like that. This is by January 21 they also experienced a third wave. So some people say is the first wave only going on, but it's actually coming like this, ups and
right,
downs.
right.
So in India, April to April, if we compare, this year's April is double than last year. So definitely, as Pancharatna Prabhu mentioned, it's a tsunami. It's not a small wave. It's a big tidal wave. So let's go to the next slide. Now, what is the difference between the first wave and the second wave? That we must understand. So you can see the various things like age, first wave and second wave, how it happens.
Yeah, yeah,
So the median age of last time it was 50, and here it is 48, 2 years down. So it is shifting to the younger population. Below 19, last time it was 4.2, now it is 5.8. Like that, it has shifted to the younger population now. And more and more children are getting affected. One more phenomenon which has happened is that there are cluster infections. That means if someone in the family or in the building gets affected, the whole cluster of a family or a society will immediately within no time get affected within a week's time. So that was not the phenomenon last time. And this may of course happen because of the lowering of the guard of people in general. Also, there is something called as the pandemic fatigue. So people have experienced a lockdown for a year. People are bored. People are sort of, they have given up now. No matter what happens, I am just not going to follow this. There's like a natural instinctive resistance to the protocol, and that is called as the uh, fatigue of pandemic, and that is also set in. There are people who are sort of dependent on daily wages, so they just can't afford not to go out. So last time, at least the government had locked down, and many NGOs, non-government organizations, voluntary organizations, they went house to house in India, and millions of kits, food packets were distributed. Now that is also not happening. So people have to come out and work. So all this has contributed to the younger population, who's generally more risk-taking behavior is there in them. They're getting infected, and because they are very mobile, active, and small children who are just maybe toddlers or 7 8 years old, for them they are, even if they are infected, they remain quite peaceful. So, and parents keep on hugging them, kissing them, and it's immediately spreads. So that is the difference between the first and the second wave, that the age group has come down. And this is, of course, taken from the government study, which they took out from the 10,000 sample of from various states. Next slide.
Is it also not there's the variants
Yeah, that slide will come. Yes, there are variants. Yes.
Okay.
So you can see this. This is a graphical way of understanding this wave, because sometimes people say these are all fudge numbers. These that no, these are all actual numbers. This is how exactly it is. Last time you see the blue line, it is going straight, slowly going up.
Yeah.
The red line or the orange line, you can see that till 11th March 21, it was slightly rising, but from March second week, it has just taken a jump, and it is just crossing all limits. So you can see the way it is going up. So this is how the second wave has hit the whole nation. And today, you can, wherever you phone up people, they will always talk about, I'm not getting a bed, or I'm not getting the injections, or I'm not getting the vaccine. It's all a scarcity everywhere, because there are too many people to deal with. That's the situation. Practically every country has gone through this. So India is not different. We are also going through the same challenge. The next point. Next slide, please. So this is how some predictions are there. This is a bell-shaped curve, which can tell you, okay, when can we have some relief? Because that's the first thing we want to know. So it generally goes like this. The waves go like this. So you can see that somewhere in the mid-May, which we will reach the peak. And then from mid-May, by July, September, we should be again comfortable. And then wait patiently and cautiously for the third wave.
The third wave. Oh, Krishna.
So that's how the epidemiologists describe this. So this is all science. We are not saying anything which is off the hat or off the cuff. Okay, next slide, please. So here is your answer to your question about the strains. So in India, most of the infections are still happening with the old strain. But yes, the new strains are found because there is the international travels were on, and people sort of imported this kind of strains. You can see that Karnataka, the variants have come from Brazil and South Africa, whereas Delhi, Punjab, Kerala, Maharashtra, Bengaluru, etc. All these cities, they have got mostly the UK variants. And there is one more sublineage of the UK variant, which is found in Bengal and Delhi.
Mm.
So this is how the new strains, but whatever the strain it is, uh, the people are getting affected. Of course, in this particular wave, the case fatality is lower than the previous one. Various reasons can be there to why it is low. One is that yes, we have got the medical fraternity, the healthcare system has got now ample experience of dealing with corona as compared to the last year. Last year it was a completely new thing. Not many people knew exactly how it affects the body and
Yeah.
what kind of interventions can be done. So it was all trial and error. Now it is more or less, very, very clear. It's a standard treatment everywhere we go. And people are reporting earlier as compared to the past. In the past, people were afraid that if they tell the government that they have some fever, they will be quarantined in some God forsaken place and they will be cut off from the family.
Right.
So they would hide it. And because of that, the whole family sometimes would get affected and the person would become critical. Only then he would go to the hospital. But now
Right.
people are themselves coming out to test for COVID with the slightest. A lot of education has happened through the social media and from the various government institutes and private institutes. So the earlier the detection, the greater is the chance of good survival and good outcome. The later the detection and hiding of the symptoms or ignoring of it by out of either ignorance or of fear, higher is the chance that you will succumb or you will be critical.
Yes. Yes.
So that's how it is. Yeah, next
I
slide.
remember that was like the number one message in perhaps our first broadcast with you and others, that early report, early, just get it early, really is the first thing to be concerned with.
Yes.
So yeah.
Next, please. Yeah. So, how did we, as Bhaktivedanta Hospital, uh, play our role? So, obviously, we are devotees, and devotees go by Krishna's words. So, naturally, when many institutes, health institutes were closed and people were not coming forward in the first wave, our hospital, because we are based on the principles of Gita, Karmanyeva Adhikaraste Mahapadeshu Kadachana, we wanted to do our duty. And of course, the friend in need is a friend indeed. And a Vaishnava is friend to all people. He is a Paradukha Dukhi. So with all those principles deeply embedded in the devotees and even the other people who are working in the hospital, our hospital took up this challenge right from day one.
Yeah.
And we developed our own COVID hospital, dedicated COVID hospital, which is about a kilometer away from our Bhaktivedanta Hospital. So we have a separate unit. So far, we have treated more than 3,000 COVID-19 patients. Out of them, about 722 were ICU patients. And we have got, in this area, we are sort of rated the highest for the standard of treatment. And all the leaders of the society, whether they are rich people, politicians, government officials, they will always make sure that they get admitted with us. So that is what we have done so far. We also had a laboratory created for COVID-19 RT-PCR test, which was inaugurated by the governor of Maharashtra. Of course, it was a e-inauguration. That means he was sitting in the governor's house,
Yes.
and we are in Bhaktivedanta Hospital. So, and today we are some of the largest RT-PCR tests are being done by us for Mumbai and this whole region. So far we have done about 1.2 lakh sample testings of the COVID test. Then another thing which is taken up by us is to help the government. So government officially wrote to us that saying that our hospital, we want to convert into the COVID hospital. Please help us with setting up an ICU, giving us the standards, protocols. So our whole team, from doctors to nurses to infectious disease specialists, chest physicians, everyone, including the administrators, we set up the whole thing, set up the protocols which are of international standard. And in 15 days, we had commissioned that hospital. So these are some of the things which we have done. Of course, we have definitely through our, we had a rapid response team. We created a rapid response team because if a devotee or a staff member gets detected for COVID, naturally the whole family goes through a panic emotion.
Yeah.
And they don't know what to do. There is a lot of confusion and helplessness. So we had a rapid response team which was 24/7 available. And the person doesn't have to think about how much money to spend or who will spend the money, because we had created even a fund. Yeah. So that because all our staff, doctors, they had contributed to this fund voluntarily from their salaries. And so no one has to think about where the money will come from, where the medicines will come from, how the family will be taken care. Everything was taken care. And because of that, we could serve our own caretakers, the staff members and the doctors and the devotees in a very, you can say, modestly nice way. That's all I would say. It cannot be the best because the situations are like that. Yeah. Next slide, please.
By the way, as we're going to the next one, just to our audience, if you have questions, we're going to, at the conclusion of this presentation, we're going to be taking questions. And so any question you have, you can just type it into the comment box in either on YouTube or in Facebook, and then we'll be able to address them. So let's go on to the next slide. Give me a second here. And what do we have but questions? Okay.
So this is before you ask, like, if any questions beyond this, you can still ask. But these are the frequently asked questions. So, say, basically people keep on thinking about, we should do something extraordinary. But no, you just do ordinary things and you'll be okay. Because I'm here, example, so far at least, that I have just used mask, a proper distance, and hand hygiene. These are the three things. And I have been entering all the COVID regions and treating COVID patients and seeing every day COVID patients, and still I am COVID negative. So it works. Yeah. That's my point. It definitely works. Does the virus spread through the air? Now there are very various, theories, and WHO keeps on changing its stand, and some journal or some scientific society says yes, somebody says no. But the spread through the air is very less likely. It can be there, very less.
Clarify what you mean is as an aerosol, as opposed to just drops coming out from somebody and going
that means
through the air. But it's a different, I know aerosol. You could. Someone gave the example of like incense scent. That floats through a room and you can smell it somewhere else. So that kind of travel of the virus is, I think, what you're talking about.
Very unlikely, very unlikely. But of course, as you correctly said, it's while speaking and while eating and speaking, the droplets which come out, which have a range of say 1.5 meters or 2 meters. That's why that distance has to be there. So somebody, even if he speaks, the droplets will not reach you. So it is less likely that it spreads to the air, but droplet infection is the fact. What
Yeah.
precaution to be taken to protect children if I'm positive? If somebody in the family is positive, simply he has to isolate himself. And again, isolation works best. Isolation means complete isolation. You have to have your separate bathroom. You don't come out regularly. You just be there. Whenever you come out, wear a mask and do not talk to people. Do not sit with people. Simple. And again, with this, again, self example, all three members in my family, we have a four-member family, two children, husband and wife. All three of them at different times they became positive. And I'm in the same house, I'm still negative. So I'm telling you, it works. It works. Can COVID-19 be caught from a person who has no symptoms? Very unlikely, because again, uh, unless you are very much in close contact, it is unlikely that it will pass on to you, because he is not going to cough, he's not going to sneeze, he's asymptomatic. Next slide.
Can you see it?
Yeah. So regarding vaccine, there is a lot of what we medically term as vaccine hesitancy in the people, particularly in the devotee community, because of various theories which are floating around, and sometimes it is because of the possible sin of a calf who is being killed for creating such a vaccine. What about several reasons? Sometimes it is because of the side effects. Sometimes it is because of some kind of rumor that why it is being made. Whatever it is, vaccines are safe and effective. And any vaccine which is around you, generally, vaccines will never come in the market unless they have at least more than 50%, at least 60-70% efficacy, which is good enough. Even if somebody tells you I am going to protect you 70% of times likely to be protected, you will take that protection. Why not? So we will say that wherever you are staying, in whichever country, whichever city, whatever vaccine is available, just take it. Do not delay it, because delayed vaccination is also one of the causes of this second wave and the third waves. Because uh, naturally, more and more population is sort of vulnerable if they're not vaccinated.
Yeah.
Do I need to wear a mask and avoid close contact with others if I have gotten 2 doses of the vaccine? Yes. The same whether you are vaccinated or not vaccinated. Universal precautions have to be followed. So when will this pandemic end? It's $1 million question. Everyone wants to know this. And when we can become again normal, we can meet together, go to Mangalarti, whatever. So again, it is anybody's guess. We do not know when it will end. But as I showed you the previous curve, in India, it is expected by mid-May we should be sloping downwards. Already last 4 days, at least in Maharashtra where I am here, the cases have gone down. Beds are again available. So it has started coming down slightly. Of course, it is very early to say anything, but we can see a downward trend.
Hmm.
Next. So uh, some people wanted to know about the home quarantine. Like someone is positive and he doesn't want to be getting admitted in the hospital. Naturally, home quarantine is a very good option. There's nothing wrong with it. And I would say home quarantine, if you do it properly, uh, because as I told you, in my family, three members have been going through this. They had symptomatic problems, and still, all of them they did very well. So, some must do's are four things the National Task Force has recommended. Very simple: keep physical distance, wear mask even within the house, and strict hand hygiene. As soon as you touch something, you have to immediately wash your hand or sanitize. Good hydration with liquids which are hot in nature, not cooling in nature. Antibiotics whenever you have fever or body ache. antitussives if you have cough, and multivitamins and good diet. Of course, you need to be under medical supervision, so be in touch with the doctor regularly. Monitor your temperature and oxygen saturation. This oxygen saturation, I want to spend few minutes on this, or few lines on this. So there is this oxygen pulse oximeter, a finger pulse oximeter. Previously, only the doctors would use it. Now everyone uses it. You apply it on the finger, and you see what is your oxygen saturation. It is above 95. You should be happy. It's normal. After that, then you walk for up to 6 to 7 minutes. Then check again. If it starts going down, previously it was say 98 and it becomes 97 and again 98, you are comfortable. But before walking it was 98, and after walking it has come down to 94. So a drop of 2, 3, 4 on a regular basis. After 1 minute, after 2 minutes of walking, if there is a drop, it's an alarm. It's an alarm, and you must immediately seek medical help. Do not take it lightly. Another way, a feeling sometimes also indicates air hunger or lack of oxygen. Many times people feel that I had viral fever. I'm not having COVID. I just had a viral fever because I was tired. And then after a few days, he doesn't have the same energy as before. So he thinks that, oh, this viral fever was not good. And it is still not allowing me to come back to normal. So I'm tired. Then slowly he cannot even walk properly. And he says, this viral fever is really bad. I'm so weak that I cannot even walk. But actually it's not a fact. He is not able to walk because there is no oxygen in the body. He's not weak. It's the lungs have been affected. So therefore, whenever anybody feels very weak while walking, sometimes person cannot go to the toilet. He goes to the toilet and comes out taking deep breaths. You should know that this person is in a dangerous situation. Or you yourself, you are in a dangerous situation. Immediately go to the hospital. Okay, next.
Yeah, that is. I didn't say this, but my wife and I have had COVID, and definitely, the oximeter was something we were checking every hour. And then for my wife, it did go down, and fortunately here in Mayapur, they were able to supply some oxygen, and now we're getting okay. But yeah, it's monitoring that oxygen level is really, really important.
So because there are a lot of discussions in the ISKCON circles about vaccination. So few of us got together, myself, some of the doctors from Bhaktivedanta Hospital, 2 doctors from South, one or 2 doctors from UK, some from USA. I can share the list of the names later on. But then we thought that we should put out a statement as devotee doctors for the devotee community. And whoever wants to look at that statement, so here is, I'm going to read it as it is. So as of, this was April 12, we took out the statement. As of April 12, 2021, the following vaccines are authorized by at least one national public health regulatory authority for emergency authorization use. 2 mRNA vaccines, the Pfizer and Moderna vaccines. 3 conventional inactivated vaccines, Corby, Covaxin, and CoronaVac. 4 viral vector vaccines, Sputnik, Oxford, and Covishield. Covidicia and Johnson & Johnson vaccine, and 1 peptide vaccine called Epivac Corona. So these are the vaccines which are available in the world today. There is currently no evidence that any of the COVID-19 vaccines cause fertility problems or alter DNA, because this is one of the concerns. As of April 12, 2021, 781 million doses have been administered worldwide. Next. For serious side effects that would cause a long-term health problem are extremely unlikely following COVID-19 vaccination. Here I want to say something on the point number 4, that sometimes you hear that one death occurred or 2 deaths occurred or whatever. Many times when the vaccines are still being researched, even with the vaccination drive going on, those who are vaccinated are also being followed up. So in that times, research times, anything happens to a person when he has taken vaccination is reported as related to vaccine. Later on, they go into that deep discussions and sort of post-mortem of the incidents. And then they come out, okay, this did occur because of vaccine, or this did not, and it was just a coincidental. So all the deaths and whatever severe things have happened have been attributed to be accidental so far. Point number 5. Very rare cases of blood clots and decrease in platelet counts following vaccination with the Europe's AstraZeneca vaccine and Johnson & Johnson vaccine have been reported. Yes. The entire schedule of vaccination is completed by only one type of vaccine, as different COVID-19 vaccines are not interchangeable. So once you have taken Covishield in India, you should take second dose of Covishield. If you have taken Covaxin, go to Covaxin. And in other countries, whatever other vaccines available. 7. A Scottish study of 1.1 million individuals were vaccinated and hospitalization rate fell by 84%. You can see the results. These are all available results. This is just 4 weeks after receiving the vaccine. So you can alter these third wave immediately by mass vaccination. Vaccination reduced the overall attack rate from 9% to 4.6% in United States of America. Vaccination markedly reduced adverse outcomes with non-ICU hospitalizations, ICU hospitalizations, and deaths in decreasing by 63.5%, 65.6%, and 69.3% respectively. So huge gain just by these 2 shots of injections. Next. 9. Individuals who are pregnant, breastfeeding, have a history of autoimmune disease, cancer, or who have had a severe or immediate allergic reaction called as anaphylaxis to any of the ingredients in the vaccine should consult their own doctor prior to getting a COVID-19 vaccination. So suppose you have taken previously some vaccines and you are known for getting anaphylactic reaction or allergic reaction, you should tell your doctor that this has happened. Approved COVID-19 vaccines are safe for HIV patients. So even if you are immunocompromised, you should take it. 10. It is important for the people who have had COVID-19 to take the vaccine because the immune response to 2 doses of vaccine might be bigger, better, and longer lasting than just getting the infection one time. So getting infection one time is like taking 1 shot of the vaccine. 11. It is vital that everyone continue to wear a mask, sanitize, and maintain social distancing after getting vaccinated until experts gather more data. Next. Okay. So that is the vaccination kind of statement from the devotee doctors. And as I told you, doctors from UK, US, and India, and I think somebody from Singapore and Australia also. These are all devotee ISKCON doctors. They have all signed this document.
Is that the statement and the signatures and the so on and so on, is that available on your website somewhere?
If you want, I can send it to you and you can put it up wherever you want.
Yeah, we could publish it. I mean, again, our disclaimer: this is information.
No, this is not by you. This is by us.
And we're simply relaying. It's not an official position or anything like that. but information is information, and
Yes.
we want, the devotees should have information, and then they can make their own choices and decisions.
Yes. So I'll send it to you, Pancharatna Prabhu. You can do whatever you want to do with it. Okay.
Yes.
And now this, there is also a lot of discussion on how the things are happening in India, and there is in international press, India is like seen as, oh my God, what's happening? But actually, that's not a fact. Because if you see, for some strange and maybe spiritually oriented reasons, or maybe the lifestyle oriented reasons, India's case fatality rate has been always very low as compared to all other countries. Uh, so you can see here, this is taken from one of the websites of international organizations. So in the Western countries, overall population is 139 crores, and in India it is 138 crores. And total COVID fatalities in the European and Western countries is 20,63,689. Compared to that, same 138 crore, almost the same population, the fatality is 1 crore 95 lakh 123. So 120th. And this has been always constant. So even if you double it, still it is much low. So this is the data which is actual in India today. So why this is happening? Because again, as I said, the Indian population has natural immunity. Their lifestyle is more or less or more vegetarian oriented. There is a very robust family system where people are less stressed out by sharing. And also, India is still going ahead with the BCG vaccination, which has been always there. So every child born in India gets BCG vaccination, which many countries in the West have given up. So BCG also is supposed to have some kind of a immune boosting system because of the live Bacillus calamite-guerin, that is called BCG, that vaccine. It's a live bacteria which is injected right at birth. So these are some of the reasons, and also the spices we use, and haldi, turmeric every day people are using, and the kadhas and so many. I think India has practically over flooded itself by all the kadhas and various things to do, and so it's a joke that some people ask, have I done everything today? So there are 50 things to do every day for prevention of corona. So, but of course, from my side, you take whatever kadhas and all, but follow all the precautions. And dear devotees, sleep well. Sleep well. If there are less sleep and stressful life, these are two enemies of immune system. So if there is any dispute in the family, whatever is happening, just relax. Life is too short. Take it lightly. Just move on, joke about it, sleep well, and read your favorite books because you don't have much thing to do right now. So this slide I wanted to specifically show because these are the certain things which we have to see from positive angle also. Next. Now this is something which I want to tell the devotees, that the Bos indicus, the Indian cow, Gomata. So she has given us this fantastic immunomodulator. Now this was first tried in the Dharavi slum of Mumbai. About 10,000, because Dharavi was most affected area in the first wave. And by July itself, by July 20, Dharavi was completely, you can say 70% people already had COVID in Dharavi. So in that Dharavi area, many people, volunteers, they went with this cow urine, and there were 1 or 2 additions to that, gave it to every house. And they brought out that whole slum from the pandemic fear. And then they came to us saying that, Why don't you utilize this for your patients? I said, I'm not going to utilize anything unless I see the authenticity, I do a research on it, and we did a research along with IIT Bombay and the Sarveshwar Sahkar Sanstha. So these three institutes, Bhaktivedanta Hospital, Bombay IIT, and Sarveshwar Sahkar Sanstha, we conducted a research, which I'll just show only one slide from the research in the next one. Of course, yeah, this is another slide which shows that the ingredients are FDA approved. It's not that it is something done illegally. We have taken permission from the Ayush Ministry, FDA. It is properly through the ICMR and the Ethics Committee, National Ethics Committee for the research. Everything is done properly, and then the research is conducted. Next. So these are the results. You can see. See, the orange is those people who did not take this Ayurkoro, the medicine which we have as a immunomodulator, and the green or the whatever color it is, greenish color, it is Ayurkoro 3, the medicine which is to be added to the existing treatment. So existing treatment can be zinc, vitamin C, ivermectin, azithromycin, doxycycline, various things which are being given as a standard and approved by the health ministry. So whatever medicine you are taking have to be continued, and we gave to one group, we gave medicine of Ayurkoro 3, and another group we did not give. And this was a blind study. That means the doctor doesn't know and the investigator doesn't know who got it and who did not get it. And with that, these are our results. So results on day 3, the cough. 84% of people compared to 38 in the non-Ayurkoro patients, 84 patients felt relieved of cough within on the next day 3 of administration. Breathlessness, 92% of people experience completely lack of breathlessness on day 3. Testlessness, the test returned in 75% of cases on day 3. Fever went away in 88% of cases on day 3. So this is just the day 3 data. Then there is a day 7 data also. We have more research on this, but I am just, with the time which we have, I just thought I will show this only one slide just to make an impression that it's an extremely effective thing. And we have not only given this to our hospital patients, but almost 1,200 ISKCON devotees from Mumbai, Pune, Kharghar, Govardhan Eco Village, and all these areas, 1,200. And all of them, many of them, they did not have to ever come to the hospital. Not a single person went to ICU, not a single death. So it's an amazing medicine based on cow urine. So I would say if devotees want to take it for prevention, they can take it once in a month. If they already have symptoms, they just take it. But it is not a medicine to cure. It is help to cure. So therefore, you should still be in contact with the doctors. You should still continue whatever treatment is being given. And along with that, just to augment your recovery, or you can say, do it faster, you add this. Next slide. So for those who want to ask how to go further in case you require this Ayurkoro 3, so this slide shows the number on which you can order it. It is better to take under doctor consultation. If you have some confusion, there is another number. And this is the helpline or the website where you can log on, and through website also you can order and take consultation. Next. Hare Krishna, and thank you very much. So
that was really very, very informative. And in fact, we have a number of comments saying exactly the same thing. But we also have questions.
Yes. We can take questions quickly.
All right. So let's see how to do this, because we have quite a few questions. I'm going to go up to our through the comments here, and give me a second here. Okay, let's go up here. So the first question that somebody had was about traveling in air-conditioned trains and flights and so on. Any comments about travel?
Yeah, the first thing is if you can avoid it, should be avoided as much as possible. You travel only if it is necessary. It is extremely critical for you to travel, then only you go, because aeroplanes and closed air conditioned coaches of the trains, the airflow is not there. It's an internal air. So even if one person has and he sneezes or coughs or he leaves his droplets while speaking, they will remain in the air for some time. And many patients who travel, after travel they catch COVID. Quite a common known factor. So I would say avoid travel unless it's a must.
Okay. And if you are traveling, if you must travel, then what do you do to what?
Yeah, then you wear a N95 mask over your nose and mouth. Don't eat in between unless it's a day long travel or something like that. And wash your hands wherever you touch. As soon as you touch, keep a sanitizer in your pocket, immediately touch. Don't keep it a habit. You touch anything, immediately sanitize. So don't think that I touched a clean surface or I touched a cloth. No. Wherever you touch, as soon as you touch something, wash your hands or wear gloves. Because with gloves, the advantage is that with gloves, you never poke your nose or you don't rub your eyes or you don't put your fingers in the mouth, because this is where the infection comes from.
Mm-hmm. There was a devotee here commenting about Ayurveda and so on, but you've done some, given us some hints about that. In addition to the product that you mentioned, are there some other? We've heard of the Coronil product, and we've heard of taking other immune boosting stuff. Is there, for those to boost one's immune system? Your research department, your Ayurvedic department, have they come up with anything to advise?
So immune boosting, there is a few things which we recommend from our side to all our patients, whomever we know. One is to prevent, you can at least once in a day, you should have a good steam inhalation. You can have gargles with cow urine, just 1 spoon of cow urine and 1 glass of water, warm water, and just once or twice a day you gargle. Many of our doctors have been doing it. Use of kadhas, which are very well available on the internet and other places. There are many kadhas which are given by specific Ayurvedic institutes also. Whichever kadha you take, that's quite fine. And
by the way, for those who don't know, kadha is a type
kadha
of
is
tea that
what
made
do you
from
call it?
turmeric and ginger and this and that.
It's called a decoction? What is it called as in English?
Yeah, it's kind of because you boil it down, so it is a
Yes.
decoction.
Yeah. So I wouldn't, because I'm not Ayurvedic doctor. I'm just saying there are enough available. If you know some Ayurvedic doctor, but only precaution I want to tell. Without any offense to any of my Ayurvedic colleagues, many times there are false claims and false security is created by too much of saying this you take and nothing will happen. Don't fall in that trap. Never fall in that trap. Also remember, if your immunity is already compromised due to various reasons, either cancer or some steroid medication, you cannot boost it to normal. Say somebody makes you rich from wherever you are. So if you have only 100 rupees, how much rich he can make you by multiplying that 100 rupees? It can go to 150, but it cannot become 1 crore. So boosting means whatever you have, it just increases slightly.
Yes.
So originally, you should, if you have good immunity, that's good. And as I said earlier, and I repeat it very often because people do not understand the importance of it. Please sleep well. Sleep
Mm.
more than usual. I I always used to sleep for 6 hours, but now I sleep to 7 to 7.5 hours.
Yeah.
I sleep
Yeah.
more. It's very necessary. And eat
Mm.
in regular times. Okay.
So let's see if we can. We're getting close on here from our own team. We have a question here about, yeah, and I think the India, the vaccines in India. The question here is a little long, so I'm not going to put it on here. But basically, it says that, we know that they're not magic bullets. They're they're not 100% effective. They're some percentage effective. Uh, what about the India vaccines? What is the studies say about their effectiveness?
So both the vaccines, Covishield as well as Covaxin in India, they have efficacy around 70%. Covaxin is slightly better than Covishield as far as efficacy is concerned. And Covaxin is made up of the whole whole virus killed virus, whole killed virus. That
Yeah.
means as a complete virus with the cell wall, the spike protein, everything is as it is. It is just made ineffective. So because of that, it is more effective. Also, the current recent data shows that it is effective against all the possible mutant strains.
Hmm.
So Covaxin definitely is preferable, and I have been telling devotees to take Covaxin as much as possible. But the Covaxin, if it is not available, do not wait because it. See, the today the demand is huge, and now from 1st May, anyone who is above 18 is eligible for vaccination. So the demand will go further up. So whatever is available to your neighborhood immediately, please take it. Immediately
Yeah.
take it. Do not wait for a particular vaccine. So this is
Okay.
my understanding.
And let's see. We've got uh, one devotee. Let's see. Just put this here about home care techniques, and you did share some of these things. What people should do at home. I think you mentioned the first thing you do at home is you contact your doctor, and you have a doctor that you're in touch with, so that you're ready if something, and you get
Okay,
one of
as a
these.
devotee, we have less time now. I'll just finish this. As a devotee, my humble request to all of you, please do not get into the trap of all these things. Just whatever pranayam you do, whatever basic exercise, you continue to do that. A normal lifestyle is very important. Do not go into any techniques. Just be normal, and more than techniques, sleep well, eat well, be positive, be fearless, take shelter of holy name, take shelter of the devotees. This is more than sufficient. And when whatever comes your way, vaccination, do it immediately. As soon as you have the first symptom, do not hide it. Go and test it. And once you
Yeah.
test it, if you are positive, do not worry. If you come early, you will be saved. There's no doubt about it. Because we have never seen deaths, those who came in the first week. Generally, the 7th day to 17th day is the dangerous period. What happens is the people think that I had got fever, now I'm normal, there's no fever. And on the 7th day, he starts feeling weakness. 7th to 17th day, his lungs are getting eaten from inside by the disease. And that's the critical period when they do not understand that why I'm feeling so weak. And that's when the oxygen level starts going down. That's a dangerous time. So be educated and be empowered through education and take early help, sleep well, eat well, take kadas, and whatever other techniques you do, do it. Do not get into trap of all kinds of fake news and fake rumors about negative sort of propaganda. That's my point.
Well, it's been really very, very wonderful to have you with us, and I'm sure there are going to be more and more questions. And I feel that we should keep having these type of programs fairly regularly, so devotees can ask questions, and perhaps your medical team and so on are available. I think you posted
Yes.
some numbers. You've posted some information. We'll put that information also along with in our Facebook and YouTube channels, where people can contact your team with more questions if they have questions that in terms of their treatment. And different issues like that. People who are perhaps in remote areas and not able to get to the highest quality care. One Before we end, however, is there any? You did give sort of a strong message there at the end about early detection, early treatment. Any other closing comments?
My closing comment is that you are all wonderful devotees, very dear to Srila Prabhupada and very dear to Sri Lord Krishna, Gauranga, and he wants you to be alive. So please take care. Please take good care. Do not get into panics. Just just make sure that you are going scientifically, because unscientific things also affect you a lot, which is very common in our
Yeah.
ISKCON circles. That's all I would say.
And from our side, we have some closing comments as well, and that is the power of prayer and the power of just surrendering and giving ourselves to the protection of the Lord and praying for others. And for that purpose, we're actually we're launching what we're requesting. I'm just going to show something here. Uh, we're requesting that the devotees this weekend take some extra time, as you pointed out, in India particularly, but all over the world, devotees are affected more and more. Some places are getting down, but India, as you saw, that curve is likely to go higher and higher. So prayers are always very meaningful for the society, for the devotees, and kirtan is recommended, the Kirtan Yajna, the Sankirtan Yajna, as being the most appropriate way for us to, or at least a very powerful and appropriate way for us to pray for the well-being of others. So we're encouraging all the devotees to offer kirtan for all those who've been afflicted by COVID-19 and for the protection of others this coming weekend. And for more details on this program, which is being done in collaboration with the Kirtan Ministry, you can visit this page, gbcspt.com/Kirtan Prayers. You can also visit Facebook, Kirtan Prayers Global, or you can see here bit.ly Kirtan Prayers. Basically, we're asking people do Kirtan, and if you can, stream that Kirtan on your social media so more and more people see it and take part. And if you like, you can also stream it on the Kirtan Prayers Facebook page. And then finally, send a report to Kirtan Prayers at ISKCONKirtanMinistry.com. And that report will be offered to Lord Nrsingadev here in Mayapur, so that he also gets to know personally about these efforts. So this is just one more way for all of us to join together as a family to pray for the well-being of all of those who are afflicted with this disease. It's not a disease to be taken lightly, I can tell you from my own experience, and it is something that we have to really pray not just for the devotees, but for the whole world. That is our mood as Vaishnavas. So thank you again, Madhavananda Prabhu. To all of our viewers, again, if you're not subscribed, please subscribe to our mailing list so you get news about these events. Come to our website, like us on Facebook, follow us, subscribe to our YouTube channel, click the notification bell, and keep up with us. We focus on caring for the devotees, both in the realm of their physical care, but also in their spiritual care. I hope many of you have enjoyed our Chaitanya Charitamrita series. And if you missed anything, it's still there. You can go back and get it. So please keep up and let us serve you. Thank you, Madhavananda Prabhu. Thank you
Thank
for
you,
the
Pancharatna.
entire Bhaktivedanta Hospital team. Thank you for all of the service that you're doing. And we really, really appreciate it. Hare Krishna.
Thank you very much.
Thank
Hare
you.
Krishna. Thank you.
Hare Krishna. Thank you, devotees.